Many thanks for staying with us. You're still watching Good Morning Namibia, of course, that lovely insert produced there by Catherine Goss as one of the producers on the Good Morning Namibia desk, looking at rheumatic fever, of course, with Dr. Mbawala there. We continue with more healthcare matters. This is Good Morning Namibia coming to you on the sidelines of the 24th edition of the Ongwediva Annual Trade Fair, taking place under the theme Innovate, Connect, Prosper. Now, this morning we've invited, that's Sister Theresa Willson. She is the manager for Paediatric as well as the Neonatal Intensive Care Units at Ongwediva Medipark. And this morning we discuss a very topical matter, which is specialized care for some of our youngest patients. Now, prematurity and childhood critical illnesses present unique challenges that require highly specialized care and support. And at the Ongwediva Medipark, advanced facilities like the Paediatric Intensive Care Unit and the Neonatal Intensive Care Unit ensure that vulnerable newborns are cared for and critically ill children receive world-class treatment close to home. And she is here to unpack what these services are and, of course, how they've managed to take care of the little ones. Sister Theresa Willson, a very good morning to you, and thank you for being with us here on Good Morning Namibia.
Good morning, Ndishishii. Thank you for inviting us.
Yeah. Thank you so much for being with us. Perhaps I'd like to start with just looking at the state of prematurity in Namibia, in your experience as a sister, of course, as the manager of this important units. What is your day-to-day experience at Ongwediva Medipark as far as prematurity is concerned? And let's define prematurity in today's day and age here.
Prematurity means a baby who's born too soon. A baby was born too soon, meaning that before 37 weeks of gestation. These babies, a full-term pregnancy is a completed 40 weeks of pregnancy. Beyond 37 weeks to 40 weeks, it's classified as full-term pregnancy. Less than 37 weeks, it's premature babies. And these are also categorized by the weeks. We have extreme prematurity defined 22 weeks of gestation to 27 weeks. Very preterm, 28 to 31 weeks of gestation. Moderate preterm, 32 to 33 weeks of gestation. And then the late preterm is 34 weeks to 36 weeks and 6 days, because on the 7th day they are then classified as full term.
Full term, okay. When we speak about it, and I like to simplify, these conversations for the sake of our viewers. When we speak about 22 weeks, for instance, we're referring to roughly 5 months or so.
Yes.
That's quite short of the typical 9 months that you refer to here.
Yes.
Yeah.
So these babies are definitely born very immature. They have breathing problems, they have liver problems, they have brain problems. These problems, why? Because the body in the later weeks of pregnancy, the baby's body is still being developed.
Yes.
But now if they're born too soon, some babies born at 22, 23 weeks may not sound viable, but they are born breathing.
Okay. Yeah.
And then we do something because the baby's alive.
Very much indeed. Talk to us about some of the services you provide at the Ongwediva Medipark's Paediatric and Neonatal Intensive Care Units, and of course the capacity of the unit as well.
Our capacity at Neonatal ICU, it's a 15-bed Neonatal ICU, where we have a range of management, basically caring for the sick preterm baby or even a full-term baby. A full-term baby might have breathing problems, which persist beyond days, and then sometimes with these babies with the breathing issues, our pediatricians, we work with 3 pediatricians at Ongwediva Medipark, might request a pediatric cardiologist to come and do an echocardiogram. And on those times, sometimes congenital cardiac defects are detected. Sometimes the babies have a normal heart. It's just that the baby might have an infection in the lung. Babies who are jaundiced, who require phototherapy, sometimes, not often, thankfully, exchange blood transfusion.
Okay. Okay.
Babies with infection, or babies whose mothers have had complications during their pregnancy, maybe diabetes, maybe hypertension, and other infections.
Can of course play a part.
Can cause a baby to become quite sick. And require care in neonatal ICU. Our capacity, we have a nursing ratio that we work with sick ventilated baby.
Okay.
It's usually two babies and one nurse.
One nurse, okay.
Or a critically ill baby requires a one-on-one ratio of nursing care.
Fantastic.
Yes.
If to what degree you may divulge, what has been your success rate in treating these babies and of course these complications here?
We have a success rate, but then sometimes due to the severity of the prematurity, babies born with extreme infections or extreme low birth weight, like under 900 grams, under 700 grams, they come with complications because they're in that category of high risk mortality.
Very much. You mentioned, of course, certain complications that could arise during the pregnancy and that could contribute to these complications. You've mentioned, of course, high blood pressure, diabetes as examples. What other contributing factors do we see in women that lead to prematurity, that ultimately lead to these complications with the babies here?
Sometimes I think when moms fail to attend antenatal clinic, they might have undetected or undiagnosed maybe urinary tract infections, or even flu, or even maybe misuse of drugs or alcohol. And with alcohol abuse, we have a condition that babies get, which is fetal alcohol syndrome, and that comes with another array of complications. Yes.
Very much. Let's talk about some of the technology that the Ongwediva Medipark has adopted to, of course, take care of these little ones. We know the Ongwediva Medipark is one of the foremost medical institutions here in northern Namibia. Talk to us about the equipment, of the units, etc.
We are very fortunate to have state-of-the-art equipment at Ongwediva Medipark in our hospital as well as in our units in NICU. We have our specialised infant warmers, our ventilators. At one time we had the most ventilators for neonatal ICU in Namibia. I'm not sure where we are now, if we are still in front, but we had the most ventilators to take care of our babies' needs.
Fantastic.
Yes.
Great stuff. Sister Willson, of course, I had the pleasure of just chatting with you off air before we got on air, and I was talking to you about, the beyond the physical. Oftentimes, healthcare requires, especially in today's world, requires huge mental support, psychosocial support. When mothers are going through this, or when children are going through this, it's not only them, but the mothers are going through them with this. Talk to us about the importance of supporting mothers from a psychosocial perspective, taking care of course, the mental awareness as well. We know that oftentimes mothers may develop certain feelings towards their children, may feel guilt perhaps due to the prematurity, etc. Talk to us about the importance of the psychosocial aspect here.
Thank you for the question. We certainly recognize the importance of supporting the mum emotionally.
Yes.
And this is where the bedside, the primary nurse plays a vital role, because the primary nurse will recognize the mum's depression or the mum's anxiety or the mum's concerns. And then we have a very close relationship with our doctors where we actually advocate for the mums to get counseling or beyond, to get a social worker involved in the situation.
Fantastic.
And daily updates are communicated with our parents after the doctor's rounds in the units, both in NICU and in PICU. So the parents are updated about the baby's condition and also the progress, or if the baby's condition worsens, and they are kept informed.
Fantastic. I'm really glad that you do have that three-pronged approach to your healthcare. Just lastly, Sister Willson, before we let you go, of course, just talk to us about the importance of early medical intervention, for those expecting mothers, the importance of seeking medical intervention from the onset, and of course making sure that your doctor is with you on this journey.
I think for mums, it's very important to seek medical help the moment you find out you are pregnant, and then also for the partners to support them.
Absolutely.
And sometimes, especially in the first trimester of pregnancy, the mum really needs to be monitored closely. There's also medication that she needs to get to prevent birth defects. So, for example, with folic acid, if a mum misses getting folic acid or taking folic acid, the baby can be born with defects, neurodevelopment defects, or congenital like spina bifida.
So it's very important that you, of course, follow everything to the T.
And support. And then once the babies leave NICU, it's very important before leaving NICU that baby should have be on medical aid, have a birth certificate, be registered on medical aid, and most important is babies must be taken for follow-up care at 6 weeks of 6 weeks after leaving NICU. Why? Because the baby is still developing. Sometimes after the 6 weeks, it might be now there's a problem. Maybe there's a heart sound that wasn't there before, and now there's a problem. That's why it's very critical not to miss the follow-up appointment.
Sister Theresa Willson, thank you for being with us this morning. Thank you for the work that you're doing at the Ongwediva Medipark, and all the best to you and the team in taking care of our little ones.
Thank you. We love what we do.
Very much indeed.
Thank you very much.
There you have it. Sister Theresa Willson, pardon me. She's the manager of the Paediatric as well as Neonatal Intensive Care Units. That's at the Ongwediva Medipark, talking to us this morning, of course, about some of the complications that come with prematurity, also the work of the units as far as taking care of the little ones. Of course, also just talking to us there about the capacity of these units. So if you are, of course, expecting mother, to make sure that you take care of your little one from the very onset, seek early medical attention, and ensure that you do have a pleasant, of course, journey throughout your pregnancy. To stay with us, we continue right here. This is Good Morning Namibia. And of course, we took to the streets of the Ongwediva Annual Trade Fair Center, where we engaged the public about their experience of this year's 24th edition. To stay with us.